doctors, in the last video we had discussed about the importance and scope of cosmetology in clinical practice. Today's video will be discussing about whether cosmetology, Ayurveda cosmetology, has been mentioned in the classics, in the Ashtangas. So my question to you is that have you noticed, have you ever heard of cosmetology as an anga? The answer would be no. And is cosmetology mentioned specifically in any of the angas? The answer would be no. But according to me, cosmetology is a beautiful amalgamation. Ayurveda cosmetology is a beautiful amalgamation of all the Ashtangas. Now, you'll be wondering how. We know that the Ashtangas are Kaya, Bala, Griha, Urdhvanga, Shalya, Damshtra, Jara and Vrisha, right? 8 angas in total. Now, let me explain you my concept of how Ayurveda is a beautiful amalgamation of all the Ashtangas. Now, let's start with Kaya Chikitsa. Now, you'll be wondering how Kaya Chikitsa, how cosmetology is relevant in Kaya Chikitsa. Let me give you an example. So, a patient comes to your OP with dark velvety patches on their neck, okay? And they say that I've been to a lot of people, I've been to a lot of doctors, I've tried a lot of things, basically, but I'm not getting any results. Now, this condition is usually called acanthosis nigricans, and this is usually seen in the neck, the armpit area, the groins, and also the folds of the joints in people. The thing with acanthosis is this is seen in conditions, patients with these 3 following conditions, which are first and foremost insulin resistance, secondly diabetic people, and thirdly people who are obese or have recently gained weight. So the relevance of Kaya Chikitsa here is that unless you treat the underlying condition, you have to talk to the patient, you have to understand what the underlying condition is, and only after that will you be able to treat a patient with acanthosis. No amount of creams, no amount of Varnier drugs, no amount of packs will help you in treatment. Very recently, I think last week, I had a patient who had come to me and told, doctor, I've seen a lot of patients, I'm not getting any results, and he was a man in his 20s, early 20s. So because he was in early 20s, I didn't jump into insulin resistance and diabetes first. I asked him, have you gained weight or any issues with your weight? So yeah, he told me, yes, I did gain a lot of weight in the last year, and the discoloration had started because of after I started gaining weight. So I told him, okay, listen, this is the case. Once you have to, you will get only results after you treat the patient, if you treat the condition. And especially in cases like these, we have to, that is the first line of treatment. And only after the treatment, supportive, when you give Varnier drugs, you get results. So this is just like a tip of the iceberg in the case of Kaya Chikitsa. The second thing, the second anga will be Kaumara Bhritya or Bala Chikitsa. Now, when it comes to Bala Chikitsa, when you are sitting in an exclusively cosmetological OPD, like I do, you will get a lot of cases. You have very young children. I've seen a lot of cases, children as young as 6 years old having premature graying, hair fall, and dandruff, which can be seborrheic type dermatitis or in that spectrum of diseases. So very important, most of the cases like hair fall and premature graying, there is definitely, in the cases of premature graying, there is a genetic factor. But usually the case of hair fall, we have to treat the, again, underlying cause. It will be mostly deficiency. So you have to have a grasp of Kaumara Bhritya. You will have to have an understanding of how to treat the conditions. And only after that, most of the cases in Kaumara Bhritya, there will be need of correction of Agni. The children won't be having appetite. So again, you have to have your basic grasp, because definitely you will get a lot of cases, especially hair fall cases in your OP. Next one is the most interesting one, which is Graha or Manasika Roga. So my approach to Manasika Roga in cosmetology is in 2 ways. You'll be wondering how. The first case, people who actually suffer from diseases like stress, depression, anxiety, and sleeplessness. Okay, all these are the most common conditions which we have. A lot of physical manifestations occur, especially in the skin and the hair. Skin is the largest organ, so a lot of issues in the skin come, conditions like acne, flare up of acne, under eye pigmentation, dull skin, blotchy skin. You get a lot of cases like that. In hair, definitely the first and foremost thing which you see is hair fall. In conditions like these, where patients are suffering from conditions like the above mentioned conditions, what you have to do is you definitely have to treat the condition, or else you won't see any results. No matter how much oil you give, no matter how much tablets you give, you won't receive any, you won't see any conditions unless and until the base cause, the nidanam, is found out. My second take is I see a lot of patients. See, definitely when they come to my OP, especially youngsters, definitely cosmetology OP, you have to ask, are you stressed out? And when I tell them, ask them, are you stressed out? They tell, no, I have no problems, but I am stressed out because of this acne, or I am stressed out because my hair is falling. Most commonly, youngsters speak out. So, especially in cases of telogen effluvium, a patient, you know, what you have to do is you have to like counsel the patient, you have to console the patient, make sure they're okay, or else here another very important thing related to cosmetology is, you know, you have to make sure that patients, like, okay, you have to give them a time frame, you have to tell them you have to do this and do that for getting proper results, or else you won't get results. But you have to make sure that you don't give them unrealistic expectations. Unrealistic expectations from patients is the biggest enemy of a cosmetologist. Okay, so you have to make sure of that. So to succeed as a cosmetologist, one of the most important arsenals you should have with you is, you have to be a very good listener. You have to be able to counsel them properly, and you have to do things like that. So manasika is very important from a cosmetological point of view. And then we come to urdhvanga. Now, this is this anga in which most of the common cosmetological diseases come, which is Shalakya Tantra. In Shalakya Tantra, the most common ones which we see are in Kshudra Rogas, right? All the important diseases which we deal in cosmetology is, you can see the signs, symptoms, and the treatments in Kshudra Rogas. So definitely that should be totally in our hands. The treatment protocol should totally be in our hands. The next one is Shalya Tantra. Now you'll be wondering, Shalya Tantra and cosmetology, how? Now three most important areas of interest in Shalya Tantra are Agni Karma, Kshara Karma, and Rakta Moksha. Now you'll be wondering, Agni Karma, how? See, Agni Karma and Kshara Karma are used for the procedures like cautery, where conditions where patients come with warts and moles, and if you're sitting in a OP, which is, you know, cosmetology OP, exclusive cosmetology OP, you'll definitely have to do all these procedures. Now, Rakta Moksha is mentioned in the classics for conditions like Indralupta, and what I find very interesting, my love for Acharya, my love for the science, you know, has increased after reading a lot of, you know, articles, especially related to PRP and GFC. The mode of treatment, the mode of action, the principles are very similar. Rakta Moksha, the principles of Rakta Moksha and PRP are very similar to each other. So that is wonderful. Our Acharyas, the PRP had come into existence around, I mean, for hair, PRP has been around from 1970, but PRP for hair has, you know, was introduced in around 2006. Our Acharyas had found this almost 5,000 years before now. Rakta Moksha is absolutely important. We can do Prachana, we can do Jaluga. All of these things are very much effective in cosmetology. And if you want to take your cosmetology OP a bit higher, a level higher, you know, you have to do these procedures. The next one comes Agada Tantra. How? The concepts of Doshivisha, Garavisha and Viruddhahara are very important as far as cosmetology is concerned, because right now we are using a lot of products, we are using a lot of cosmetic products, a lot of them manifest as Doshivisha and Garavisha, and the biggest and the most important part is Viruddhahara, because now the diet and lifestyle nowadays affects so many aspects, especially in cosmetology, especially the way people look, the way people feel. So definitely we have to keep an eye open for that. Then comes, last but not the least, we can take Rasayana and Vajikarna. It's not the same, but for understanding aspect we can take them into one account, which is antioxidants. Right? So again, two takes for antioxidants. The first one is, our textbooks are filled, our textbooks are completely beautifully filled with antioxidants in the form of rasayanas, formulations of rasayanas, and in the form of single drugs like botanicals. Now, when it comes to antioxidants, like I mentioned in the previous video, we are lacking, the Ayurveda community is lacking in R&D, which is research and development. It is up to us doctors, it is up to the Ayurveda community to make sure that the beautiful yogas, the beautiful drugs mentioned in Ayurveda can be used for cosmetology in the future. Now, drugs like Brahmi, Centella Asiatica are becoming very common for cosmetological preparations. The opportunities are endless. We just have to make sure that we exploit what we have, we make it into formulations, we make it for daily uses and all. The next method would be antioxidants. Have you heard of vitamin C, vitamin E, glutathione, and niacinamide? I mean, the list is endless, but have you heard of these? All of these come under the heading of antioxidants. Now, when it comes to if I have to speak about that, we need hours and hours for that. But there is a very interesting connection between glutathione, which is an antioxidant which is produced in our body, and Acharya Rasayana. Very beautiful, very interesting connection. Now, this connection I'll be talking about in the future videos. Definitely I will be talking, because the respect for our acharyas, what we are finding nowadays, acharyas had found 5,000, 6,000 years before. Now that is not a small feat. Now it is up to us, it is up to our Ayurveda community to make them, we have to take it forward in a very beautiful way. So I've spoken about all the angas, I've spoken about the Ashtangas, and I have tried my best to explain to you how a cosmetology is relevant in each of the angas. Okay, so what do you say, doctors? Isn't cosmetology a beautiful amalgamation of all the angas? Yes, it is. So this is all for today, and in the next video we'll be discussing about facials. Facials is a very long, very beautiful topic, is a very vast topic, so we'll be doing it in different parts too. In the next video we'll be doing about introduction for facials. Until then, it's goodbye from Team Drona.